The 17 News at Sunrise podcast is brought to you by Clinica Sierra Vista.
Welcome back to the 17 News at Sunrise podcast, where we share your news on your schedule.
Working in the spirit of the Golden Empire, this is 17 News at Sunrise.
Good morning here at 5 a.m. on this Tuesday. I'm Maddie Jansen alongside Alex Fisher.
Continue to follow up on the latest at the overdoses at North High after several students overdosed on campus. And this morning there's growing outrage from parents and students as they walk out as they accuse school officials and the Kern High School District of trying to cover up the situation. As those concerns mount, another student was rumored to have OD'd at North yesterday morning. Mark Coram with Hall Ambulance confirmed an ambulance was at that school. Throughout the day, dozens of parents picked up their kids as worry grows.
I'm worried about getting that phone call, like I'm sure everybody else is, getting the phone call that my kids did, because nobody wants to do nothing about it.
KHSD announced yesterday evening that school nurses and police officers have administered Narcan 5 times at schools to children overdosing on opioids since the beginning of this school year. The district says it has trained its school nurses and school police officers to use Narcan, which can reverse opioid overdoses. North High is hosting a parent meeting to address these concerns. It's happening tonight at 6 o'clock and is expected to have more information on the investigation of these overdoses at the school.
Well, as cases of fentanyl use and inadvertent exposure rise in some Kern County schools, it prompts the question, does the county have a uniform, comprehensive plan of attack in place to fight this drug epidemic? 17's Robert Price looked into it and files this report.
The fentanyl overdose crisis continues to escalate in Kern County, where more than 600 people have died over the past 3 years, each of those years more deadly than the previous one. Despite those surging numbers, though, Kern County still does not have a dedicated task force to develop uniform guidelines and target one increasingly vulnerable population, teens. This is the latest threat, rainbow fentanyl. Brightly colored pills, powder, or chalk-like blocks laced with the deadly drug 50 times more potent than heroin. And this, reconstituted Jolly Rancher candies, which drug dealers can manufacture in their kitchens with a microwave and a candy mold. But now, following overdose incidents at Chipman Junior High and at least 2 Kern High School District campuses, East and most recently North High School, local school officials may be starting to take things more seriously. Following a California Department of Public Health advisory issued last week, warning school districts across the state about these new forms of fentanyl and urging them to develop policies regarding the opioid overdose reversal drug Narcan, some are acting. The Bakersfield City School District, of which Chipman is a part, will discuss possible new regulations pertaining to, quote, administering medication and monitoring health conditions. A district spokesperson tells 17 News that translates to fentanyl and Narcan. And following a week-long outcry from parents over a handful of overdose incidents, North High is holding a forum, also Tuesday night, at the Oildale campus. Countywide fentanyl task forces are not new. Sacramento County has one in place that includes the district attorney's office, law enforcement, county public health, county mental health, medical providers, and school districts. Among their policy decisions, who should be permitted to carry and administer Narcan, the OD reversal nasal spray. 17 News tried to ask the Kern High School District and Kern County Board of Supervisors leadership for clarity on policies related to fentanyl. Their response? Right, not a word. What message should these agencies be sharing with the public? Maybe something along the lines of what Audrey Chavez has been saying literally for years. She's with the Bakersfield AIDS Project.
It's as simple as this.
That is Narcan nasal spray. Chavez says it should be in school nurses' stations, alongside defibrillation machines, in school administrators' offices, and in teachers' desks if they want it.
We need to have these tools available.
600 plus fatalities over the past 3 years. Is Kern County prepared to do something in a uniform, organized fashion? Perhaps we'll start to find out Tuesday night. In Bakersfield, Robert Price, 17 News.
If you felt shaking in the Kern River Valley early this morning, you have a 3.7 magnitude earthquake to thank. The quake hit around 1:15 a.m. It was about 8 miles southeast of Bodfish and 26 miles northeast of Tehachapi. Fortunately, though, no damage was reported. Maybe just woke you up.
A 15-year-old girl is missing this morning. Police say she was taken by her father after he allegedly killed her mother. Shelby Nelson with our sister station in Los Angeles has more.
They do believe that Anthony and his daughter Savannah is with them, and at this time, because of what occurred, we believe that Savannah could be in danger. So this is why we put out the Amber Alert.
A chaotic morning starting with a deadly shooting near Cypress Elementary School in Fontana. Police say at around 7:30 as parents walked their kids to school, suspect 45-year-old Anthony Graziano of Fontana was involved in a domestic dispute with another woman. That's when police got several calls of shots fired at the intersection of Cypress Avenue and Mallory Drive.
Confirmed that one female adult victim was down and had been suffering from multiple gunshot wounds.
After the man jumped out of the truck and he started running that way to the corner, he was shooting while he was going, and people were running all over with their kids every which direction.
One vehicle with its rear window shattered. A parent who did not want to be identified says he and his son were getting out of his car so he could drop him off at school when he heard about 10 gunshots go off moments before a woman crashed her van.
It was an execution that I saw today. I seen the white truck behind her, and I heard another volley of gunfire, around another 10 shots around there. And then I seen her run from the driver's seat, run towards the sidewalk. I could see her face and everything. It was the fear on her face. That's what's bothering me the most.
The witness says the victim fell to the ground. She later died at a hospital. He says the suspect then either reversed or made a U-turn, hitting an innocent bystander's vehicle with his white truck before opening fire again.
I heard another volley of gunfire while she was already on the ground.
Police believe Graziano then left somewhere and picked up his 15-year-old daughter, Savannah, prompting an Amber Alert. They believe he's driving a white 2017 Nissan Frontier with a rack on top and distinctive stickers on the side. His license plate 44305G2.
That was Shelby Nelson reporting. Well, they survived the fire that raged down Chester Avenue in 1919 and the 1952 earthquake, only to be done in by what appears to be arson. Fire crews demolished 2 Bakersfield landmarks yesterday, each more than a century old. They burned down at a 3-alarm fire in downtown Bakersfield earlier this month. The fire started around 10:15 p.m. on September 7th at a building near Chester Avenue and 20th Street, a few blocks from the Fox Theater. Fire crews were battling that blaze for about 4 hours before they were able to extinguish it. A neighboring business owner who didn't want to go on camera tells 17 News he often saw vagrants entering the structure through the alley by climbing a fire ladder. Fire officials have not announced what started the fire. For more information about the rich history of these buildings, head to our website, kget.com.
And fentanyl and opioid overdoses are not just a problem here in Kern. More than 100,000 people across the country died from drug overdoses in the 12-month period ending in April 2021. That is a nearly 30% increase over the previous 12 months. Opioids account for the vast majority of those deaths. Now the head of the Drug Enforcement Agency is warning parents across the country about rainbow fentanyl. That is a version of the deadly drug made to look like candy. NBC's Kate Snow has more.
This is on the wall at DEA headquarters in Washington. Thousands of faces gone because of fentanyl.
So you're adding to the wall every day.
Every day.
It's overwhelming to see in person.
Now lawmakers on both sides of the aisle demanding action. Authorities overwhelmed. So many deaths in Los Angeles, the school district is now putting the overdose reversing drug Narcan in every school, K through 12. DEA Administrator Ann Milgram is deeply concerned about the latest trend, traffickers pushing so-called rainbow fentanyl.
They're making rainbow colored pills, so all the colors of the rainbow.
Why do you think they're doing that?
So we believe that they're doing this to get new users, to appeal to younger users. We're finding it all over the social media platforms. It looks like candy, and in fact, some of the drug traffickers have nicknamed it Sweet Tarts, Skittles.
It has nothing to do with candy.
It has nothing to do with candy, and we should say this as clearly as we possibly can. Many people who are dying from fentanyl poisoning have no idea that they're taking fentanyl.
They've found rainbow fentanyl in 21 states. Milgram says it's a marketing ploy by the cartels.
This is another tactic that they're using to get more fentanyl to more people. The more drugs they can sell, the more addiction they drive, the more profit they make.
She says the DEA knows raw ingredients for fentanyl travel from China to Mexico, and she blames 2 Mexican cartels for producing the drug. In the 4 months between May and September, the DEA seized more than 10 million fake pills containing fentanyl.
That's the equivalent of 36 million, more than 36 million lethal doses of fentanyl.
Enough to kill 36 million people.
Enough to kill 36 million people.
Republicans have been incredibly critical of the border policy. They say all this fentanyl is coming in because of the Biden administration's border policies. What do you say to that?
First of all, we, of course, defer to the Department of Homeland Security that has a responsibility for the border. Our job is to dismantle the cartels, to stop the global trafficking that is happening. We cannot wait. We cannot wait until the fentanyl gets to the border or to the ports to act.
Milgram says she comes to this wall often, a reminder that the job of the DEA is to save lives. Kate Snow, NBC News, Washington.
Meantime, Senate Majority Leader Chuck Schumer wants to add $290 million in the federal budget to fight the spread of fentanyl and fund overdose response strategy teams. The announcement comes on the heels of that rare public warning from the DEA about the dangers of rainbow fentanyl. Schumer says drug traffickers will stop at nothing to target kids and teens.
We know that one of these pills can kill. That's black and white, not rainbow. I'll hold it up here. We know that one of these pills could kill. That's black and white. That's not rainbow. But the results are terrible, horrifying.
And Colorado Congressman Doug Lamborn proposed a bill to the House of Representatives that would allow schools to use excess COVID-19 relief money toward fentanyl education and prevention resources. The Preventing Kids from Fentanyl Act was introduced in the House last Thursday. It would allow schools to buy opioid reversal agents like Narcan, provide thorough training for school staff on how to use it, and provide fentanyl awareness classes and materials for students. The 17 News at Sunrise podcast is a production of KGET and Nexstar Media Group. For more on all of the headlines in today's show, head to kget.com.